We're asked to see a 71-year-old with diabetes, coronary artery disease that was so bad it was not amenable to bypass surgery or PCI. He had liver disease and also heart failure. I'm going to share with you 4 integrative therapies that help turn his health and therefore his life around. Welcome back to Montgomery Heart Wellness. We have another exciting clinical round for you today. Now, understand this is a 71-year-old man with diabetes, and his coronary disease is so bad it was, not amenable to bypass surgery or stents.
Right.
Tell us about this.
His cardiologist from the state that he resides in told him that he didn't have good targets because the disease was so diffuse, and he had heart failure because of the severe arterial blockage, and the heart was pumping about 25% on the echocardiogram and about 32% on the mucus scan.
It's interesting you point that out because the Montgomery mucus scan, as you point out, is thought to be a little bit more accurate, so it might have been 30%. Also, the EF can change. But the interesting part about his coronary disease not being amenable to bypass surgery is an interesting point to highlight, because oftentimes when we look at an angiogram, we see the areas that are critically stenosed. And so typically those areas are treated, with a stent or with bypass. And, proximate to distal those areas, it looks like the lumen is open. But oftentimes it's disease all the way through the vessel. In his case, they probably saw significant plaquing throughout. They don't always see that. But one of the things I like to point out is that when we do an angiogram and we do a stent or bypass surgery, we may be bypassing something we can see, but it's usually the case that you have disease throughout the vasculature. So there's a lot of disease that's not being bypassed. This was a situation where it could be seen on angiogram, so they made the decision not to try to do bypass. But it's very common when you get bypass or stenting, you're only bypassing part of the blockage. There's narrowing and plaquing distal to that area. And so that's why I like these therapies that treat the vessel systemically as opposed to in those little areas. So it's interesting that this is the case that they were able to see that on angiogram.
Also, because the heart was weaker, he had some signs of liver failure as well. When he came here to Houston, he did the ECP therapy, ozone in the form of EBU, and the detox. And he also did our infrared sauna and beamer therapies.
So the interesting thing about the liver congestion, now, there are probably multiple reasons for that. Obviously, when the heart is weak, you can have congestion of the liver, so there's backflow congestion because this forward flow is impaired. Then also the liver can be diseased just primarily from maybe the toxic diet and the lifestyle he's living. So there's 2 mechanisms by which you can have fatty liver, congested liver. So it's very interesting that he presented with that. It'll be interesting to see how he fared. So as you said, the detox diet, raw fruits and vegetables only. Then he had hydrous ozone in the form of EBU, sauna. And as I mentioned before, these integrative therapies work in a synergistic fashion. And so we often try to give patients the benefit of all working together. He's got a lot of disease to work with.
Right.
How was his kidneys?
They were okay. At one point, the GFR dipped down to the 60s, so we got him off his diuretics, and his legs looked great actually at the end of the treatment. He had no edema and the kidney function went back up. And we were able to reduce the dose of his Entresto as well, and the repeat ultrasound of the heart that we did, the ejection fraction or pumping ability of the heart had gone up to 50%. So that is normal, and I think that shows a lot. It went up also while reducing Entresto because, we all know that's one of the big heart failure medications. But sometimes, you'll often hear we still have to reduce those medicines if they're having some other adverse effects for the patient.
Yeah, yeah. And so in his situation, because of all the nutrition and the sauna, the blood pressure was going down.
Right.
So we were forced to reduce not only the diuretics, but the entresto.
We reduced the beta blocker, metoprolol. That's what we reduced.
Gotcha. So another situation was someone with multiple disease states who was able to have better control of his diabetes. I met, was he on an insulin project coming?
No, he wasn't.
So basically it was just medication, oral meds, metformin or anything? Or
No medication.
no medication for the diabetes. So we were able to control his coronary disease, improve his cardiac function, and also the liver function got better while we were reducing the medications. So improved metabolic status with these 4 interventions: nutrition, high-dose ozone in the form of EBU, infrared sauna, and external counterpulsation known as ECP. This approach can be very effective, and it's one that is very effective in patients who are not amenable to some of the more aggressive medical treatments such as bypass surgery or stent placement. They can still have hope and turn things around. So I hope this is very beneficial to you. And as always, leave your questions and comments in the comment section.